Hello, and welcome to this World Health Summit session on strong partnerships as a determinant to health, bridging the public, private, and political powers to accelerate the attainment of the 2030 Sustainable Development Goals. This is a session co-organized by the Unite Global Parliamentarians Network to End Infectious Diseases, by the German Health Alliance, and by UNAIDS. It is my great pleasure to welcome you to this session and also to give you just initial remarks as we jump into what I believe will be an interesting conversation with very esteemed colleagues of ours and high-level people from the global health world. I am Ricardo Baptista Leite. I'm a medical doctor and trained in infectious diseases, and also a member of parliament at the Portuguese National Parliament, and the founding president of Unite, the global network of parliamentarians, which is co-hosting this session. And I will be your moderator for this session. Just to give you a brief overview of what brought us together. Well, first of all, I have to say that I regret that we're not personally together in Berlin. We were all very much expecting for this travel opportunity, but sadly the COVID-19 pandemic has kept us at home. So I've been held back in sunny Portugal. Well, I can't complain. But anyway, I have to say that it would be better to be with all of you in person. Unite is a global network of parliamentarians, as I mentioned. So we are currently in more than 60 countries, more than 130 members of parliament. We've organized ourselves into 10 regional chapters across the world. And we are focusing at ending infectious disease as a global health threat through our political action. That means as members of parliaments, of congresses, of senates, we try to use our influence to go across the aisle to create coalitions of the willing of different parties towards achieving political impact. We as parliamentarians have the power to not only change policies and laws, but actually to allocate resources where they are needed, to be sure that we keep governments accountable, being at the interface between the people that elect us and political power. And we, I think, given our role in countries around the world, understand the importance of partnerships and how to achieve them. And hopefully, along with two other organizations, which are partnerships by nature, the German Health Alliance and UNAIDS, we will certainly come together in the same spirit, with conclusions that hopefully will help us move the agenda forward in these very troublesome times. I have to say that we have had multiple efforts trying to move the agenda forward at Unite. Most recently, we organized our first global summit, and we are now actively working, for example, along with the ACT Accelerator towards making sure that the COVAX initiative is a reality and gains the momentum and support it needs across the world through parliamentarians to make sure that vaccines, when made available, are made available to everyone across the globe, and hopefully will be another tool to hopefully end this pandemic. This being said, I can't stop but to think that 1 year ago today, we were exactly in Berlin at the World Health Summit in a pretty packed session, but a lot of people were questioning if infectious diseases were an important topic. Well, today, that's not a question. And so I think that the COVID-19 pandemic has served as a lesson that we can never lower the guard when it comes to infectious diseases. And having said that, it is my great pleasure to pass the floor to someone we all truly admire, and have to say that Unite, as a global network of parliamentarians, was initially and still is today supported by UNAIDS. And so for the keynote speak, it is my great pleasure to call to the floor my friend, the Deputy Executive Director of UNAIDS, Shannon Hayner. The floor is yours.
Great, thank you, Ricardo. And very good afternoon to the distinguished guests and to all the participants to this very important panel and opening session. I congratulate Unite, as always, and the German Health Alliance for organizing this important session. And as you mentioned, it couldn't be a more timely moment to stress the importance of partnering. And I'm going to be stressing the importance of partnering with communities not just to end AIDS as a public health threat, but to achieve all the SDG targets and also to combat COVID-19. We're in an unprecedented time of colliding epidemics. Of course, in 2015, United Nations member states came together to make several linked commitments under the Sustainable Development Goals. These included the commitments to end AIDS as a public health threat by 2030, to reduce inequalities, to advance gender equality, to promote decent work for all, create just and peaceful and inclusive societies, and promote effective civil society partnerships in order to leave no one behind. But let's be honest, despite some great successes, progress has been uneven, which means overall, our progress towards meeting these goals was already off track before the COVID-19 outbreak. So now this crisis has the potential to really upend progress altogether. What are some of the challenges we're seeing? Certainly at UNAIDS with WHO, we modeled and estimated what could be potentially catastrophic impacts of COVID-19 for HIV, for TB, for malaria. For example, if HIV treatment were interrupted for just 6 months in sub-Saharan Africa alone, we would see 500,000 extra deaths from AIDS, doubling the number of deaths in just 1 year, taking us back to 2008 death rates, effectively losing a progress of work on HIV/AIDS in just 1 year. Fortunately, as we'll talk about, we're not seeing this extreme, but it's because of the agility, flexibility, and mobilization of partners and community together to keep these services from being fully interrupted or to help restart them more quickly. But of course, under COVID, we're also seeing these challenges, not just in health, also in food insecurity, also in gender equality, also in income, etc. On the ground, we have seen how the COVID-19 crisis has exacerbated difficulties for health, for income, for safety, faced by people living with HIV, faced by key and vulnerable populations, sex workers, people who use drugs, gay men and other men who have sex with men, transgender people and prisoners, as well as adolescent girls and young women, migrants, and people with disabilities. We've seen these communities disproportionately experience violence, exclusion, and arrest under some of the broad lockdown orders. For example, sex workers have been left out of financial support measures in many countries. Gay men and other men who have sex with men and transgender people have been subject to arrest and harassment. And young LGBT people have faced isolation, discrimination within their families when locked down together. And people who use drugs have lacked safe options for accessing harm reduction services and social peer support networks that have been blocked from providing services. However, as with the HIV response, organizations led by and for those same communities have been facing down violence and exclusion, mobilizing on their own behalf, providing peer support, empowerment, health services, and clear advocacy. So where we have seen successes, community-led organizations have been some of the first responders during this global health emergency. Around the world, we have seen examples of community-led organizations innovating to sustain HIV services, providing safety nets where there were none. So what's needed to see more of those successes? Political leadership that can be transformative when it works to eliminate barriers to this community response. All too often, communities are held back from being able to fully support their members and their health needs, held back by discrimination, by laws that criminalize HIV, criminalize LGBT people, and punish rather than care for people with substance use disorders. All too often, there are concrete structural barriers to the community-led response. A shrinking space, including funding for the multiple roles that civil society and community-led organizations play, a lack of social contracting legal frameworks or mechanisms for the government to directly fund these community-led organizations. And in COVID, we've seen failures to consider community-led organizations as essential service providers, restricting their actions, and a failure to include community leaders at the COVID decision-making and planning tables. Political action can overcome these barriers to partnering with communities. And, talking on behalf of UNAIDS, why do we at UNAIDS bring such strong convictions on this element of partnerships? It's because of 4 decades of learning from HIV have demonstrated this, that community engagement and leadership are central to a human rights-based and effective public health response. This is why community-led organizations are actively involved in HIV governance at a global and national level. They're partners in planning. They are partners for direct service delivery and community monitoring and accountability. They are key infrastructural elements of the resilient HIV response system. And activism, we've seen courageous community activism that has led to some of the most important breakthroughs in the HIV response, speeding the development of life-saving medicines, pioneering innovations to ensure affordable pricing for commodities, and pressuring governments to move from denial to commitment in confronting HIV. Civil society groups have led efforts to strike down punitive laws that drive heavily affected populations away from services, such as longstanding laws criminalizing same-sex sexual conduct that were invalidated in recent years in Botswana and India. Communities also serve as irreplaceable accountability watchdogs for the HIV response, ensuring that what's been promised is actually being delivered on the ground. For example, in Western and Central Africa, where community monitoring has been alerting officials to dangerous medicine stockouts and generating data that is informing the national HIV response in this difficult time. In addition, communities deliver essential HIV prevention, treatment, and harm reduction services and provide critical non-biomedical support that improves health outcomes, reaching underserved people who are not effectively engaged by health facilities. So partnering with communities is integral for success against HIV, against COVID, and to accomplish the SDGs more broadly. We cannot achieve this without dedicated political will to ensure that a fully resourced health response that explicitly includes community-led responses and infrastructure as a core and funded part of the system is there, with the community element not as an add-on, not as optional. And this is reimagining a future system for health that can be resilient and serve all. Practically, this means national policies and budgets must prioritize health and social funding for organizations led by and for community members. There must be a legal basis for community-led organizations to be recognized. The state must have mechanisms for social contracting, the ability to pass money directly to these organizations to provide services. And then monies have to actually go to fund these organizations and the important work they do. It means urgently rolling back excessive use of criminal law while creating enabling legal and policy environments for civil society to operate. When it comes to COVID, at a global solidarity level, we can also put these principles into action by supporting the call for a people's vaccine. A COVID vaccine that is, after discovered, is rapidly produced at a scaled level, and that vaccines are available first to the people who need them most, be it healthcare workers or those most at risk of bad health outcomes. But that access and distribution is based on need, both across and within countries, rather than on wealth. So I really do think we are at this make or break moment to build a future that is definitely and truly better and more resilient, but we need the bold political leadership to reset on the right path with human rights, with gender equality, and with communities in all their rich diversity at the center and empowered to act. So this is a difficult time we're all in together, but I think it's an opportunity that's made things more clear as well. So I hope these elements of partnerships can be central to what we're doing together as we go on. Thank you. Back to you.
Thank you, Shannon. Very important remarks as we kick off this session around the partnerships, and really under the spirit of SDG 17 of generating those partnerships. And I think that underlying your words is clearly the vision that universal health coverage is only possible if everyone is included. And to achieve that and to reach those in the margins many times of society, we need community to have a seat at the table, to have a binding voice when decision making comes about. And having that activism come up not only from the community, but also from political leaders, and making sure that their voice is heard and that they are capable of doing what is needed to make sure the community has the resources needed, that we end the laws that are a barrier to achieving the goals that we aim to achieve. And now, in the face of COVID-19, the people's vaccine may become a reality. Thank you very much for your opening statements. And now I'm going to open the floor to other interventions from the rest of the members of the panel. And it's with great pleasure that I'm going to invite Hendrik Streeck, Professor and Director of the Institute of Virology and German Center of HIV/AIDS at the University of Bonn. He will speak to us on promoting evidence-based approaches in an age of fake news, the importance of science as a critical component of effective health partnerships. Hendrik, the floor is yours.
Thank you very much, Ricardo, for the introduction. And thank you to Unite and the Global Health Alliance to organize this very important session and inviting actually the International AIDS Society to be part of this session that I'm going to represent today. Well, distinguished online guests, as you just heard, we are living in yet another pandemic, and my colleague Shannon has impressively showed us that the HIV pandemic is far from extinction, but somehow COVID-19 moved the spotlight. Yet again, there are many parallels between the two pandemics, and there's much to learn from HIV and AIDS on how to deal with this pandemic. From discrimination and stigma to false hope and fake news, this all has happened during the AIDS pandemic and is still happening in far too many countries of the world. However, in particular in terms of research and conducting research during a pandemic, there are many parallels. Indeed, research during a pandemic is not the same kind of research one would do in ordinary times. Doing research in a pandemic is not about finding new and cool stuff. It's about being quick and vigilant to meet two ultimate goals. First, reducing death and suffering, but also enable life during the pandemic. Second, ending the pandemic and ensure that each and every one of us has access to prevention. I'm here in the name of the International AIDS Society that will have their first global meeting, at least that's what we hope, next year in Berlin to showcase how far the HIV and AIDS researchers came in the pandemic. Next year marks the sad 40th anniversary of the first description of AIDS in 1981. Since then, we are living in a pandemic, the HIV/AIDS pandemic. However, with access to treatment and care, people can live a normal life expectancy with the virus. With enabling strategies, empowerment, advocacy, and preventing strategies, we are living with the virus. And while there's globally much to do, we are already doing much better, although we still have not achieved that every individual that needs treatment has access to it. However, one of HIV researchers' greatest victories resulted not from scientific breakthroughs alone, but from forming a common front with policymakers and HIV activists. From the early days of the HIV response, activists pressured politicians to give scientists more resources to research the virus and called for better access to treatment. The global COVID-19 response is the latest proof that we are most resilient to health threats when scientists and politicians work hand in hand and inform one another, and when the public receives clear, coherent, and transparent information. Transparent information can only be communicated when the scientists, politicians, and the public agree on the common understanding that science requires open discussion and the will to collaborate. The importance about science is not that not a single researcher, not a single virologist, epidemiologist, immunologist, clinician, or anyone else knows the truth. There's not one truth in science. The view of a mathematician on the pandemic might be much different than the view of a virologist, but one of it is not the only truth. We need interdisciplinary and open discussion without judgment, as only the view from all sides and taking all evidence-based facts into account will allow for finding something similar to the truth. Being HIV researcher has made all of us activists by default. Now more than ever, we all, scientists and politicians alike, need to play a similar advocacy role. We need to foster our interactions and let us not be divided. At the same time, we need to stand together to counter lies and myths and protect the integrity of science, integrity of scientific discussion, and not add fuel to smear campaigns against one or the other scientist. Although the AIDS epidemic taught us that misinformation is lethal, it also showed us how powerful the medical and research communities can be when they work together, speak up, and demand attention and action to address the crisis. Teamwork makes the dream work. Teamwork needs to be brought together. Teamwork needs to be organized. Teamwork works only when scientists feel invited. And ladies and gentlemen, as the current pandemic has shown us, the alleviation of the crisis works best when scientists are systematically brought to the table and are allowed to make fact-based intervention to give policymakers a compass at hand. For this, we need a strong United Nations system. We need a strong WHO, and we need a strong UNAIDS program among many other UN entities. With all criticism that may exist about these organizations, a lesson that HIV and AIDS pandemic and now the COVID-19 pandemic taught us that the pandemic is global and that we all need to fight this together. Across borders, across continents. We need a strong WHO that has the ability to quickly contain emerging hotspots and has the means and resources to coordinate research worldwide. Well, imagine a world where not every single country, every single institution, and every single lab is performing their own experiments, write their own publications, and flood the preprint servers with new findings, but that we do this in a coordinated fashion, in a synergistic fashion where researchers across the globe unite in the fight. It is time for coordination on all levels, and while a fully integrated system may be a wishful thinking for now, if we only achieved half of it, if we had milestones in the effective fight against the pandemic, if UNAIDS and WHO has the power and resources to bring together researchers across the globe, we would achieve in a short time more than we do now. I therefore call on governments to foster scientific discussion, foster teamwork, and learn the many lessons we talked today about from the HIV/AIDS pandemic. A pandemic does not end in one country, one region, or one continent alone. It does not end by one institution, one researcher alone. It needs a team. A pandemic is global, and so we have to be global. Thank you very much.
Thank you very much, Hendrik, for your interesting remarks and for staying on time. I think it was very clear your vision on the importance of the multidisciplinary approach, but also how HIV researchers and scientists have actually played a role in terms of playing also an activism and an advocacy role, fighting for scientific integrity, which is something that correlates very closely with something that we need today to make sure that science is not forgotten in the midst of all of the confusion that we are missing, and the need for coordinated research responses is very clear. Thank you for that, and we're moving on in our schedule with our next speech from our dear friend, the Honorable Member of Parliament from the German Bundestag, Professor Andrew Ullman, who is also a medical doctor and infectious diseases specialist himself. And he's also not only a member of the Unite Parliamentarians Network, but the chapter chair for Central and Western Germany. He's a very good friend of ours, and he's going to speak to us for 7 minutes around health is a political choice, breaking silos through evidence translation and parliamentarians' engagement, and the specific case of SARS-CoV-2 management. Andrew, thanks for joining, and the floor is yours.
Yeah, thank you very much, Ricardo, for the welcoming remarks. And also thank you to Shannon and Henrik, who gave a wonderful speech right now. And I couldn't agree more what was said, because last couple of weeks, this reminded me very much of my beginning as a young physician in HIV and AIDS floor, where we had the first cases during my medical school time, and then later on how I built up an outpatient care facility in our university to take care of HIV and AIDS, and the parallels that we're facing today with fake news, with discrimination, is very much the same, just a different point of view of things. but similarities are obvious. But what we're facing now is uncertainty and fear in our societies on a global scale. And many countries didn't face this since the Second World War. The spread and the impact of COVID-19, it is one of the heaviest or the worst things that we have actually experienced that we had so far in our life. But political leadership needs to ensure that we give the right choices. We have to ensure immediate, large scale and coordinated actions to implement and to ensure equal access to the COVID-19 vaccines once available. Today, I saw a lot of interesting news, even across Europe, how the countries are actually making sure that the vaccines are kept in their countries and not shared globally. And I think Henrik said it very correctly. We can never tackle this pandemic on a local scale. We have to tackle this pandemic on a global scale. And it's encouraging that many major and domestic and multilateral initiatives have been created to mitigate the health and social and economic devastation due to this pandemic. There are three points that I like to point out what is important for a politician. Politicians have to trust scientists, specialists, physicians, and epidemiologists in this situation. Medical professionals and experts provide policymakers with the accurate forecasting to access how many COVID-19 cases are possible and what are the appropriate interventions and what may be the consequences for the limited supplies that we have. We in Germany right now have big discussions about our testing facilities. For example, we need to understand that we just cannot waste our resources. We have to be careful what we're using with our testing facilities. But the other issue that we're facing a lot, and I see this as a person who is a scientist as well as a politician, what is evidence? How do we weigh in evidence? A lot of people say the science community says, and we all know who are working in the science community that there is not one truth. And I think Henry said it very nicely. There is not one truth in science, and especially if there is one truth, it is in flux. It could change within a week or so. And this flexibility is a big challenge to many politicians because they want to pass a law in 4 weeks and be sure that this law doesn't change for the next couple of years. So that is a big challenge because it's not a law of nature evidence. And this has to be made clear for political decision makings, and it's not trivial. And of course, I would agree as well that research during a pandemic is totally different as the normal research. The pace is very quickly, and even the data, if you have the data today, for example, for a vaccine trial, next week additional data could bring a different outcome in the vaccine trial. And this is has to be made very clearly that we are learning on the run, and it is not trivial to translate the evidence that's available into political decision makings. However, and that's the second point I'd like to point out, is we need to be consistent in our messaging that is scientifically based and not ideas bringing out there that I have a good idea and let's translate this into a law. This doesn't work that way. We have to use the scientific basis, and that is somewhat also challenging for politicians, especially political leaders, because they would like to have a simple solution for a very complex situation. Nevertheless, they have to be mindful what they're telling their citizens, whether governments were swift or not in their actions, inconsistent in messaging or sharing misleading information to the public will devastate an already overwhelmed medical force. And we see this happening right now in Europe. We need to resist the temptation to share hopeful messages of possible treatments when there simply isn't a robust research yet. This has to be very clear. And even in German politics, I always like to compare that. Everybody's hoping for the vaccine. I'm pretty sure the vaccine will work. I would like this, but it has to be outweighed a little bit more carefully. But on the other side, we also have politicians in our country, and it's the same thing in other countries as well, that their way of doing politics is to warn by providing angst. The word German angst is, I think, very nicely here mentioned here, because fear is not very helpful in a pandemic situation. It has to be understood what's going on, and making people afraid doesn't work. The only way to be immune against this kind of fake news or situation is an appropriate communication and information provided to the community. Otherwise, we're going to lose the community, and we're going to lose in this pandemic, because we're going to overwhelm our systems that we have, the economic systems, the healthcare systems, and of course, the social integrity of the society as well. Implement policies that work. This is, I think, very important. It needs to be consistent. It has to be understood, and shouldn't change every week. It has to be very clear. We have received consistent reporting from the WHO, and we know what works. We just need to work together and share the best practices. And Europe could be better. It isn't. Coming to the end, my last statement. We need to invest in research and development and ensure equal access to diagnostics, vaccine, medicines once available. I think that is so important, since equal access to diagnostics is a key to beating the virus and paving the way for recovery from the pandemic globally. This cannot be a race for a few winners. This cannot be a race of a few countries. Act Accelerator is an important part of the solution. And I think by pooling all those resources, making sure that all countries can benefit from the access of COVID-19 products, we could tackle this pandemic very nicely. And it doesn't have to be that bad as it is right now. And I'm an optimistic person. I'm sure that we could manage the situation, but this can only work together as a global society. This is how global health works, and not on a egocentric on a local level. Thank you.
Thank you, Andrew. And I think I couldn't agree more with everything you've said. And I think that the fact that you put on the two hats of the politician and scientist, as you said, and are able to translate to so eloquently how politicians want and tend to, even the way we communicate today, the way media is built up, wanting to show very simple solutions for so complex problems, sometimes is a challenge and leads to poor solutions. And also the idea that science is in a flux, as you said, and that what is true today may not be true tomorrow. And doesn't mean that science isn't working. It's exactly the way the scientific model works. And it's very hard for the media, for politicians, and even the people sometimes to understand that. And it is in our role to combat that misinformation or lack of consistency of information. And I thank you for ending on a positive note. We need that moving forward. And that leads me to another honorable member of parliament, this time from Zambia, who is also the chair of the Interparliamentarian Union Advisory Group on Health, the Honorable Given Katuta, who I thank for joining us. And she will be speaking to us about engaging parliamentarians, local leaders in domestic resource mobilization, from the commitment to budget allocation and legislation. Honorable Katuta, the floor is yours.
Thank you so much, Ricardo. And I must commend you for the job. I would say this is a job, well done job for bringing us and for introducing Unite. I just want to talk briefly on what parliamentarians can do to contribute to the prevention of infectious diseases, outbreaks such as malaria, cholera, TB, HIV/AIDS, and also viral hepatitis. I think you are aware that the global proportion of infectious diseases have seen resurgence, and as such, they have continued to threaten the health of everyone. And infectious diseases such as pneumonia, tuberculosis, diarrhea, malaria, measles, and of course, the HIV have remained the world's greatest killers of children and young and adults, accounting for more than 13 million deaths a year, of which half of the deaths come from developing countries. Diarrhea diseases, malaria, measles, account for about 90% of deaths from infectious disease. And this has propelled to the globe to develop in an integrated and harmonized, to develop an integrated and harmonized response to that address. I would just want to speak briefly on the situation analysis of infectious diseases in Zambia, and also the communicable diseases, which have remained a major cause of morbidity and mortality. The main infectious diseases in Zambia include, of course, malaria, HIV, and TB. I'll give just a bit of example of the one of the top 10 countries with the highest HIV burden in the world, with estimated population of 1.2 million people living with HIV. I also would like to talk about the Zambian population based with HIV impact assessment of 2016 survey. However, seeing the time that I've been given, let me just quickly take you through and what parliamentarians can do to contribute to the prevention of infectious diseases. Of course, the first one would be enactment of laws that promote the prevention of infectious diseases, representation of constituents on matters of infectious diseases, oversight over commitment to preventing infectious diseases, of course, budget approval, allocation of sufficient resources for UHC, ratification of treaties and monitoring of domesticated treaties on infectious diseases, creates awareness and increase visibility of health matters. Of course, the other one would be to enhance their research on matters of health. I would also like to bring to the attention to the listeners, of course, what the parliamentarians can do. They can also, I'll talk from the point of view of politicians, to disseminate information going back to their constituents, and also to do more of campaigns, to do a lot of campaigns to help people understand, especially I'll give example of developing countries. Developing countries, there's lack of information which needs to be worked on by all members of parliament, going back to the rural areas in particular, to let people understand, and also to create awareness on how we can prevent the spreading of these infectious diseases. And that can only be done also with the help of the governments by allocating more finances or funds towards the health ministries. I'll give an example, like here in Zambia, as parliamentarians, what we've done, we've passed a bill which has allowed now for what we call the universal health care scheme insurance, that which we include to help especially those, most of these rural constituencies to be aware of how to prevent these infectious diseases. And also, in order for that to be fulfilled, there's been, of course, supporting legislation, which includes the Health Professionals Act number 24 of 2009, the Zambia Medicines Allied Substance Act number 3, the National Health Research Act number 2 of 2013, the Nurses and Midwives Act, CAP 300 of the laws of Zambia, and also the Public Health Act, Act 295 of the laws of Zambia, which provide the prevention and suppression of diseases, generally to regulate all matters connected with the public health in Zambia. To conclude, I would just like to say everyone has a role to play in advancing the UHC, especially as it relates to infectious diseases, given its importance to the well-being of people. It is also therefore important to go a step further, where deliberative efforts are made to have interventions that are targeted at addressing the negative effects of infectious diseases. Thank you, Ricardo, and thank you, panel.
And thank you, Given. I think it was a very important statement, and for sharing your views on how to deal with such tremendous challenges that you are at home in Zambia. And you shared HIV, malaria, TB, and also the role that parliamentarians can play, such as yourself, as you've been doing, not only in terms of budgetary allocation, making sure that the resources are getting where they are needed, but also in terms of speaking up, the commitment level, raising awareness. That is also so critical. And thank you for that example that really shows your commitment on achieving universal health coverage with the Zambian bill for UHC insurance. And I think that is a very important message that, as you said in your words, everyone has a role to achieve UHC. And that is something extremely important, especially with the COVID pandemic, that we do not lose track on the importance of achieving the universal health coverage goal, of achieving the sustainable development goals. So thank you very much for that. Moving forward, we now have another speech coming back now to Europe from another dear friend of ours and the co-host of this session, the chairman of the board of the German Health Alliance, Roland Good, who will be speaking to us about partnering with public and private spheres to create resilient health systems that respond to global health threats. Roland has been doing this his whole life, and we're very much looking forward to hearing from him. Roland, the floor is yours.
Yeah, dear Ricardo, thank you so much for your very kind introduction, and especially for the opportunity to hosting this important panel jointly with Unite, UNAIDS, and GHA. Truly is a privilege and pleasure to be part of this session of this year's World Health Summit, which more than ever is an absolutely needed, highly important conference and forum. Please kindly allow me to start with a very brief description of GHA, German Health Alliance. DHA consists of more than 100 leading German actors virtually from all sectors, so private sector, and industry, NGOs, civil society and foundations, science and academia. Therefore, our initiative is covering and bundling a very broad range of health expertise while sharing a strong international focus and being in a particular position to especially foster systemic approaches and strategies aiming to improve health infrastructure. And the multi-sectoral constellation of our initiative has been, in fact, a direct and logic consequence from the lessons learned from Ebola in 2014. Talking about Ebola, latest, especially after the Ebola, as well as the SARS and MERS epidemics, now even much more drastically shown by the current coronavirus pandemic, it has become crystal clear that the importance of health system strengthening cannot be overestimated. Resilient health systems are the key to successful pandemic prevention and control, and moreover, an indispensable prerequisite for overall economic and political stability and for any sustainable, prosperous socio-economic development. In this respect, international cooperation and multilateral engagement must be strengthened with the greatest possible commitment and dedication. Exchange and dialogue, especially in form of long-term sustainable strong partnerships, are of crucial importance in this context. COVID-19 is a clear warning that even in politically difficult times and constellations, we absolutely cannot afford not to continue to dynamically expand multi-sectoral and interdisciplinary cooperations and partnerships across countries and regions. COVID-19 drastically reminds us that if health systems are not well established in one region or country of the world, we are not sufficiently resilient globally, which, as at least now has become dramatically apparent, ultimately affects all of us directly. Or as UN Secretary General Guterres said already in May, none of us is safe until we all are. For the past 10 months, the coronavirus pandemic has been reminding us on a daily basis how closely and directly health is interlocked with almost all other areas. But this should not come as a surprise, because structure and content of the SDGs of the United Nations Agenda 2030 already directly and exactly imply this strong interlinkage. In order to achieve the health-related SDGs in many countries, it's necessary to strive for successful, extensive transformations of health systems. For realizing significant improvements toward resilient health systems, granting non-discriminatory access, leaving no one behind, it is essential that activities, projects, initiatives, corporations, as well as support and funding tools that are still too narrow in terms of content and time will be much better interlinked and scaled in a more targeted manner. What is not yet sufficiently achieved in the successful integration across all the existing and new innovative individual measures, so that the entire set of then well-combined improvements can develop a truly transformative and sustainable character for the benefit of the people. Strengthening health systems and the related implementation of innovations for a quality-oriented health infrastructure must remain at highest position on the political agenda. Only when health systems are sufficiently strong, usual market mechanisms, which in many countries still are not yet available in the sector, can begin to take effect. Of course, this is also particularly important for the development of local economies and thus for a sustainable, positive economic development of the countries as a whole. As with Shannon Hayder and Professor Hendrik Steg, we have two outstanding experts on HIV/AIDS in our panel. I would like to take the courage to make two notes with reference to this specific area. It needs the same type of PCR-based molecular diagnostics to detect and cope with all three following viruses: SARS-CoV-2, the Ebola virus, and HIV. PCR tests for viral load quantification in the 40 years lasting fight against HIV/AIDS may have started in Africa about more than 10 years ago. 6 years ago, West Africa was hit by the Ebola crisis. But still nowadays, in a country, for example, like Nigeria, with a population of 206 million, a capacity of only 3,300 PCR-based SARS-CoV-2 tests per day had to be noticed. At least that was a number given about 4 weeks ago. If we would have been more successful in the fight against AIDS, if we would have really learned the lessons from Ebola about the importance of diagnostics as one example, we would not see such partially tremendous lack in diagnostic infrastructure in so many countries as now unveiled by COVID-19. But now on a different side, even with our relatively small family business I'm originally coming from, starting in the year 2000, we engaged in reducing the cost of immune status diagnostics lifelong required for people infected with HIV by a factor of 20, while introducing for the first time the portable battery and solar power technological innovation, bringing the testing capabilities until then available only in the large cities to the broadest possible range of villages and rural areas worldwide, and this includes 50 African countries, more than 2,500 hospitals and labs have been successfully implemented, and mobile labs have been also equipped. The reason why a small SME we have been successful lies in many years of close and scientifically oriented cooperation with leading experts from institutes and with governments in the partner countries. These trustful partnerships at eye level have led to the right further technological developments and required innovations. However, this was an extremely long way of 12 years, an extremely stony one, full of hurdles for a small SME. So ultimately the question arises, how can we significantly compress such time access from innovation to implementation in the face of the urgent, immense global challenges? In the field of vaccine development, this has already been achieved impressively thanks to the commitment of governments and pharmaceutical companies active in this field. Just as example, while the first two vaccines against MERS only entered clinical phase 1 in April of this year, which means after about 8 years, vaccines against SARS-CoV-2 have gone into phase 3 after already about 6 months. Why should it not be possible to realize comparable accelerations being conceivable and feasible also in other integral areas of healthcare? When it comes to these required acceleration, it's again strong partnerships playing the key role. And in this context, I'm regarding UNITE and the UNAIDS Health Innovation Exchange as having the potential to become real game changers. UNITE, by significantly leveraging parliamentarian commitment, engagement, and responsibility onto a new and global level through establishing new forms of close direct dialogue and partnerships with non-governmental actors. And the Health Innovation Exchange having realized a uniquely effective bridge between innovators and implementers, as it was already impressively shown at its launch during last year's World Health Assembly. So each specific expertise of individual actors in the different sectors, based on many years of activities and projects already carried out on ground, is a kind of a code snippet. We will only succeed in addressing the major global challenges posed by the coronavirus pandemic, and much more in general working towards SDG 3, if we use an intensified, innovative, and in certain areas novel form of cooperation to combine these existing code snippets into one complete code. And this needs adopting a holistic and systemic approach to the overall strategy embedded in the corresponding impact matrix which then only can lead to sufficiently effective transformations towards resilient health systems. And realistically, all this can only be achieved by strong partnerships with reference to and in spirit of SDGs 17. So closing with very short key messages. Health is a global public investment, thus requiring global solidarity and global solutions. Health is more than a political choice. Health is a political must, which needs to be shaped as clear and consequent health in all policy strategy, continuously established at top position of the political agenda setting. Political leadership, commitment, and action is indispensable for building and carrying strong partnerships for the goals. The global COVID-19 pandemic is, at the same time, a proof for that the SDGs are extremely well and correctly set, and an ultimate wake-up call that there isn't any alternative than to spend all possible efforts for reaching the goals. At last, in addition to the already existing vertical pillars realized, for example, by the Global Fund, Gavi, etc., there is a strong need for establishing an in-size comparably funded, large and sustainable horizontal fundament of activities focusing on health system strengthening. Any pillar can only stand optimal on a strong fundament. Thank you so much.
Thank you, Roland. I think it was very important what you just told us around how now in the time that we are living with this, the rise of nationalism, how partnerships need to go far and beyond, not only between countries, but even between regions, and exactly how strong health systems are a prerequisite for sustainable development. And as you well mentioned, and you know this out of your own experience, how we didn't learn as a global health community at large, we didn't learn the lessons from HIV and Ebola on the role of diagnostic technologies and their importance. And it seems like we kind of woke up together with COVID-19, and we're all needed, including the policymakers, of course, to bring together those implementers and innovators that you mentioned. So thank you for that. I'm going to move to our last speaker. Before that, just to remind everyone, we already have some questions flowing in through the Q&A box. Please use that facility. After the last speech, we're going to have some questions to try to use our time as most efficiently as possible. So that leads me to our last speaker of the day in our session, Hila Azazdoy, who is Managing Director at the Global Health Initiative at Ada Health. Hila will be speaking to us on partnerships to build innovations that transform lives, digital healthcare to drive better patient outcomes. Hila, the floor is yours.
Great, thank you very much. And thank you to Unite and the German Health Alliance for bringing us all together to speak about this important topic of partnerships to advance the SDGs. And especially when it comes to leveraging any type of digital solution, I think the role of strong strategic partnerships cannot be highlighted enough, because I always like to say that you can have the best technology in the world, but without key partnerships, and especially public-private partnerships, these technologies will not be able to unfold the potential and the impact that we all would like to see at significant scale. So that does require the public and the private sector working closely hand in hand. And I'm looking to share a bit more about our work at ADA and how we do that and how we leverage partnerships specifically. And for that, since we have developed a solution specifically to support health system strengthening, I'm going to share my screen now to also share a bit more visually. I think everybody should be able to see this, correct? Ricardo, if you could confirm.
Yes, yes.
Great, I see everybody nodding, perfect. So what are we doing at ADA? At ADA, we're looking specifically, and I think everybody in this group is very aware of the global health challenge. So 4 billion people currently lacking access to even basic primary healthcare services, which is due to the massive shortage of healthcare workers, but now during COVID-19 is even further exacerbated, kind of the scarcity of resources and making sure that we can use these in the most effective way. And at ADA, we're looking at we have developed a symptom assessment technology over the course of the last 9 years to specifically look at, well, how can we empower people to better understand and manage their health 24/7 from anywhere where they are in the world, and help them take better informed decisions. And for that, we've looked at, well, the challenge is so huge. So we do require digital solutions and requiring medical knowledge and combined with AI together to build a very comprehensive reasoning engine that can allow people to understand their symptoms, their own risk factors, and provide people with a probability about what the possible cause could be, as well as what next step to take. And for that, we've worked very closely with medical experts, AI scientists, engineers to develop such a system. And I will share a bit more about how it works in particular. But the vision and the purpose behind our activities is to improve human health by transforming knowledge fundamentally into better health outcomes. And the way it works is that I'm taking our consumer app as an example that we've launched in 2016 and I think everybody knows what it's like to fall ill. And with that question of, should I seek care? Is it necessary? What should I do? What could it be? To really help with that specific pain point and provide a highly, highly personalized health assessment to people. And the way it works is just like a doctor would ask you about your presenting complaints to find out what is going on. Ada is doing the same in a question and answer type of format. So a virtual chatbot that is taking into account your factors, your symptoms, and then provides you with a probability of what it possibly could be and what next step to take. So whether it's seeking self-care, for example, more less complex, common conditions where it's sufficient, to either stay at home or go to a pharmacy, or even prompting people to seek earlier care when it's urgent, or directing to different forms of primary healthcare. And with that, we're kind of widening limited capacity, so ensuring more access, but we can also drive more efficiency and quality gains across the system, because ADA is working horizontally across all disease verticals. So speaking today a lot also, of course, about infectious diseases, and here guiding people more efficiently to care, but also communicable diseases. And where we are currently, so we have launched ADA in 2016. We currently have 10 million users around the world that have completed roughly 20 million health assessments and have made ADA available in 7 languages. So we can see that roughly every 3 seconds, somebody in the world is turning to ADA to find out what is going on, and not just for themselves, but also actually for others. So for example, mothers being able to use ADA on behalf of their children, or if you're in a shared household for elderly, that a household member can leverage ADA to receive critical guidance and especially instant, credible medical health information that is reliable. With the Global Health Initiative, we're looking specifically at how can we leverage the technology that we have developed to accelerate universal health coverage, so making healthcare more accessible and more affordable by increasing access to quality primary healthcare for underserved populations in low and lower middle income countries. And the way we do this, which brings us to the topic of today, is forming strategic partnerships with global health organizations, LMIC governments, and other local businesses to ensure that the technology can be integrated, and I always like to say be leveraged as a digital front door to primary healthcare. And here you can see a good example with how are we supporting and advancing this big vision. So it starts with people, empowering people directly with relevant health information. I think it was mentioned already before that misinformation is spreading during these times quite rapidly, and it's very important to receive trusted health information that is also very personalized. So it starts with empowering people to guide them and help them when to seek care, at what point in time to seek care. And via that kind of the impact for the individual is there, of course, because in LMICs, every time somebody is seeking care, it's also related to health-related expenditures, or potentially the cost of seeking care that can also push entire households into poverty. So here guiding when it's necessary, either earlier or to different forms of care, And that translates into wider systems impact. So overall increased access, but ensuring overall more efficiency, and especially now during COVID-19, when resources are limited, to really see, well, how can we leverage the medical resources that we have in the most efficient way? And kind of from a public health perspective, also looking at here, and also with infectious diseases, how can we leverage the data, the anonymized aggregated data that we're capturing, to really surface the needs of a population, what is going on, how are potentially new symptom constellations arising, just like we had it with COVID-19, where it wasn't even clear what it is, how can we detect that and leverage these technologies for improved surveillance. Coming also shortly to an end, but a little bit, what have we been doing to date and how are we leveraging partnerships? So currently our work in East Africa, partnerships are also very critical to adapt existing technologies to the local needs and requirements. So in collaboration with our global partner Fondation Botna, as well as our local partner, the Muhimbili University in Dar es Salaam, we've been localizing ADA specifically to the East African setting. So optimizing over 160 disease models, specifically to the burden and prevalence of diseases in Tanzania, making ADA available in Swahili, and that is not just a pure translation, but really looking how can we capture the cultural and linguistic nuances by working together with medical experts on the ground, and also understanding really what the needs are specifically, and via that we're looking also to expand and reach simply more people as a first step in Tanzania to learn more. And this is for me always an example of some first feedback that we've been receiving, and I think it ties very well into some of the elements of discussion today, how important it is, and in times of what COVID-19 has probably shown us, the importance of virtual forms of care, whether it's receiving with ADA critical information in the comfort of your own home, deciding what to do, which is reflected here in some of this feedback, but also what was mentioned before, the stigma around certain diseases and the anonymity that ADA can provide, since it's a chatbot, to really comfortably share your symptoms and get critical guidance that perhaps because of the challenge around stigma, people are not going to seek at the current stage. So what we see is kind of there's a lot that we can do, there's a lot of value that we can provide, but it's important to form partnerships to be able to truly leverage these. So we've started across the East African setting, and we're currently also working towards partnerships with the public sector, so with governments in particular, as the majority of people in LMICs are also seeking care in the public health sector, to really be able to enable a digital front door that is connected with the existing health ecosystem and can drive improved access, efficiency, and quality. Thank you very much.
Thank you very much, Hila. It was a very interesting presentation, and I think that you've really pinpointed how important it is focusing on the 4 billion that still access basic healthcare and finding solutions, and the way ADA Health is trying to do that, basically using artificial intelligence in a way as a catalyzer for universal health coverage, and also to focus on the potential of self-care. And another thing that I found quite interesting that has been an ongoing discussion looking at low and middle income countries is how technology, but also new thinking models should be used to help low and middle income countries leapfrog and avoid many of the mistakes that others in the richer world have already been through, and not to repeat those mistakes as we push for universal health coverage. You've shown an interesting example in Tanzania, and your adaptation to Swahili, which I think really goes to show the personal, almost the personalized approach you want to achieve, increasing access, improving medical quality, and real-time surveillance, which in an outbreak is something we are all very sensitive to. That being said, we've ended our first round of speeches and interventions, which I thank all of the speakers for staying on time. And we now have some minutes for Q&A. And we have a first question from a dear friend from GNP Plus, Jeffrey Akaba, who is online and will be asking the question personally. Jeffrey.
Thank you very much, Ricardo, and thank you to Unite, UNAIDS, and the German Health Alliance for organizing this panel. Good evening from the Philippines, or if I should say good morning already. I do acknowledge when the panel underlined the valuable role of communities in the health responses, particularly around addressing social and structural determinants of health. In fact, in a recent report that we published together with the International Community of Women living with HIV and Y+, we showed how our people living with HIV and key populations communities have quickly stepped in to bridge the gaps in the delivery of antiretrovirals and food support, and in calling the attention of national HIV programs and governments on the role of mobilizing resources for and in working together with communities to respond to the multifaceted impact of COVID-19 to HIV and also other existing pandemics, including tuberculosis. So this clearly shows that as communities, we know how to utilize the power of partnerships and our invaluable expertise, skills, and like what Shannon said earlier, the irreplaceable role of communities in health response. Now, looking at the SDGs, while SDG 3 is considered the most relevant in our work in the fight against HIV, a specific sub-target under SDG 17 calls on member states to encourage and promote effective civil society partnerships alongside with private and public partnerships, building on experience and resourcing strategies. And network of people living with HIV and key populations as part of civil society have been advocating this to member states. However, and especially during this time of the COVID-19 pandemic, our contributions have been undermined, our spaces have been restricted, and our voices have been silenced in increasing number of countries. So some members of the panel mentioned political leadership, which leads me to my question. Acknowledging the political powers that you have, what must you do to keep civil society partnerships a priority in the SDG agenda? Thank you.
Thank you, Jeffrey. I think that's a very important question, making sure that your voice and the voice of so many people in the community without whom we will not reach those in most vulnerable situations is heard, and how political leaders can protect and enable those voices to have a role in decision-making processes. Thank you. Since we're short on time, what I'm going to do is I have two more questions from the Q&A box. I'm going to share them with the panel, and then we're going to start off with Shannon and give 2 minutes to each of you, and then hopefully we'll have time for a closing session. So one of the questions comes from Mr. Chambel, who says that we have seen many partnerships during this crisis. Do you think we will get out of this pandemic with a better sense of global response? And can health be an example of partnerships for other areas like the economy or even climate policies? And I also have a question from a dear friend, Lucy Stackpole-Moore from the International AIDS Society, who thanks you all for the session. And mentioning that regarding policies that work, is there something practical that the panelists would recommend to realize universal health coverage for all, including people living with HIV in communities that are the most marginalized given the strains on health systems from COVID-19? I think these are all very relevant questions. I'll leave it to the panelists to choose to answer all of them or the ones they feel more closest to. Shannon, please, if you could please start. Thank you. 2 minutes each.
Yeah, sure. And thank you for those questions. I think they're really critical ones. Do we think a lot of different responses could benefit from this diversity of partnerships and sort of pulling together for an outcome? Absolutely. But I think, and Jeffrey highlighted some of this as well, I think the reality is we haven't applied every lesson we've already learned to COVID. We've gone back a little bit. You know, we sort of, coming from an HIV perspective, you say, okay, fool me once, shame on you, fool me twice, you know, shame on us if we're not ready to respond when COVID came along. And I don't think we were fully ready. Now, in some cases, we've done quite well and we've been scaling up, including for partnerships. It's great to see the mobilization around access to medicines and technologies and realizing that this has to be a global response. It's been great on, in some places, seeing the community-led response directly for services. But, you know, we really had this knee-jerk approach or mythology that drove some of the very early uncertain responses, that there was some sort of trade-off between a public health response and a rights-based or partnership-based response, that you had to balance these out. And the reality is there is no trade-off there. The only effective public health response that will get us to the end is one that is in fact in partnership with communities and is a right-based response. We still haven't fully seen that realized, and in part because that segment of having community at the governance and decision-making table has been what's been most missing under COVID, I think. And so when we look at other aspects as well, making sure at least those three prongs of partnership in the policy governance decision-making, in the direct response or direct service delivery, and in the community-led monitoring. That watchdog is what being promised, being delivered for people, I think is really, really important. And I think when it comes to UHC, those are principles that hold well as well, also, that those are elements that ensure, even for something that's universal, it's not monolithic. It's able to be precision public health, primary health that really targets what people need as a community, as a group, and make sure that what's being delivered is going to get us there.
Thank you, Shannon. Hendrik?
Yeah, well, I would like to answer to both of those questions. Well, first of all, I really hope that that we are learning from this COVID-19 pandemic. Currently, the WHO is eroding, is lacking support. There are strong voices against the WHO. But at the end, I hope we're going to realize that the WHO is something that we need, and that it's something that needs to have to be strong to contain future epidemics. I think one important role activists and advocacy for HIV, but as well now for COVID-19 may play, is that currently we are seeing that the discussions about, for example, here in Europe are getting very polarized, and about this right strategy, how to combat the pandemic. So it's, for example, suppression versus suppression versus epidemic, lockdown versus freedom. And if you don't foster the discussions on that, and but have like this polarized, opinionated views on that are not founded in the science, then we lose the opportunity of finding a way through this pandemic and minimize the total harm. Because at the end, what we all want to achieve in both pandemics is to minimize harm. And I think the advocate and activists can help to foster this discussion. Thank you.
Thank you, Hendrik. Now it's Andrew, please.
So many great questions and comments, and I cannot read my notes anymore at the same time. But honestly, I think this pandemic situation, it can give us a big chance on a global level. I think, or my impression is, when I talk with politicians around the world, it's the case that global health is not really appreciated. Global health security is not much appreciated. SDGs, not many know what SDG really means, especially SDG 3, and universal health coverage frightens a lot of people. Then really that people understand this. And I think this is a great chance that we in our societies could actually educate a lot of people what global health actually means, and that health, without any health, we have no development. Any situation that we could look at, that this is so important that this could work together. I'm somewhat hopeful that with those global responses that we are facing right now could actually help us with other problems as well, as global warming and working together strongly. And one point that is also my impression, I don't know what you think about it, but public health is really weak. It's weak in our country, it's weak in Europe. I think globally it's pretty much weak. It wasn't really strengthened when we only criticize the WHO. I think it's more important that as a global society, we have to strengthen WHO. We also have to take IHRs more serious. IHRs have to be implemented, because if the IHRs have been appropriately implemented, we probably wouldn't have this big pandemic, in my opinion. So there are a lot of work still to do on a policy level, but also on a scientific level and advocacy level and community level as well. I think there's more work than less work after this pandemic, but I'm very hopeful that we could tackle these challenges. And honestly, the next pandemic just around the corner, and we didn't tackle those things that are important to us as well. It's not only AIDS, it's not only tuberculosis or malaria, it's also the neglected tropical diseases that we have to take care of as well. And if we would have put all those money that's now put into COVID-19 in the for the NTDs or more into HIV or tuberculosis or malaria research, I think we could tackle one or the other diseases a lot better in the meantime. But these are the lessons learned. And for me as a politician, as well as an ID physician, I think these things can be reminded again and again and be put into a policy maker situation that is important. Thank you.
Thank you, Andrew. Given Katuta?
Thank you so much, Ricardo. Actually, looking at what politicians can do or parliamentarians, I think looking at the way the infectious diseases affect almost all the countries, to be the duty of all the parliamentarians to insist on their governments to make sure that there is enough preparedness in case of such pandemics such as COVID or these other outbreaks that we've been having, like in Africa, Asia, and southern part of America, like the cholera diseases. So it's important that Parliament should come up with legislations or enact laws that will make sure that each country is able to meet the targeted numbers that we're looking at before the 2030 in terms of UHC. And this is all dependent on the parliaments, because without any enactment of any law to force the government to do more or to put more funding, it will be of no use and it will not help the citizenries of any of these countries. So it's important that the parliamentarians, politicians should be in the forefront to make sure that there's more of creating awareness. Also to make sure that the government do domesticate all these treaties that have been signed, like the treaties that to make sure that each and every person is well covered and each and every person is not left out in terms of universal health coverage. I think it's important that governments should start taking this responsibility seriously and not just putting it on paper, but to make sure that all the governments start implementing all these treaties through their parliaments.
Thank you, Given. Roland, please.
Yeah, thank you, Ricardo. So I guess what we can see is from now and from the past that we are still too much thinking in these vertical pillars. When there's a crisis, we think in this dimension of a pillar. We have to do something against COVID-19, or before we have to do something against Ebola. These vertical pillars we are executing are tremendously important, but they need, the interlinkages need to be seen more in order to really reach people, and also to take better care about marginalized people. So that's what I try to call the impact matrix. We need a matrix of vertical and horizontal activities, and that is very complex to achieve. But we cannot separate infectious diseases from NCDs, as we see now for COVID-19, because the risk patients are those who have, let's say, cardiovascular diseases, or so. They are really heavily affected by the infectious disease of COVID-19. So that's the art we have to perform to build this matrix. And on the question of the role of activists, I mean, I have visited, I guess, for 12 years in a row, all IIS, International AIDS Society conferences, and all international AIDS conferences. And in summary, without the activists, without NGOs, civil society, a lot would not have moved in the time which we have then seen being realized successfully. So I guess HIV/AIDS is one of the best examples about the crucial importance of including and listening to the civil society and the communities.
Thank you, Roland. And Hila, passing the floor to you, just to add one more question, which I think is directly sent for you from Roland Grafe, who's saying that universal health coverage is a noble goal, and it is an excellent way to utilize data and artificial intelligence to achieve this. Data in the past had been typically private, and hence data drives data colonialism. How much has been open data being considered? And so I'll add that to the other questions, and the floor is yours. Thank you.
Sure, thank you very much. I think, yes, I mean, that is starting with that one is a very important aspect, that how can this data be leveraged for public health at the end of the day, so we can all learn from it, so we can utilize it in the best possible way. And I think if we keep in mind, this data is of tremendous value, but it's only of tremendous value when people can act upon it. And that is, a core, a fundamental role that the public sector has as kind of the dominant provider of healthcare at the end of the day. So I think it kind of takes me back to how can we ensure that? By partnerships. So we have to have a way to partner with public health, whether it's public health institutions or with the government directly, to make the most out of these things. And I think here, from a policy perspective, it's important to also have the right mechanisms and incentives in place to encourage any type of public-private partnership to leverage, whether it's the data or it's the technology in general, to improve the delivery of primary health care. So I think that is something to be highlighted a lot. And the other aspect, and I think I'm echoing here a little bit, Roland, is really to look at, there has been an approach of looking at disease verticals specifically, and potentially a major learning can be, since it's all linked very closely with one another. So another example is also, for example, that we've been also developing a specific COVID-19 screener that we've been leveraging and that we're combining with our AI-powered assessments to really also assess in these times where transmission is such a huge fear, well, how can people at home already take better informed decisions? And that, as COVID-19 is just an example, but it's important to identify who are people with certain risks in the first place. What are the underlying conditions? So I think it brings me back to my point to say, looking at that space in a very holistic way, and also looking at the technologies in a holistic way, and not just how can it help immediately during COVID-19, but how can it help beyond COVID-19 and strengthen the health system in such a fundamental way that whether it's the next infectious disease that is coming, or even just in general, given the shortage of health workers that is being faced in especially LMICs, how can holistic technologies with a very holistic approach that encompass a wide range and be really I would say, be really integrated in the health ecosystem for the long term, because in the long term, that's when you can leverage the data in the best possible way. That's when how these technologies can help with future diseases, infectious diseases. That's how technologies can also help with the double disease burden in general. So I think that would be the point that I'm ending on, to really look at what Roland said, also how can we learn from other diseases in that area, but think it from a wider angle to really look at health system strengthening holistically.
Thank you so much, Sheila. And I think that we're, as always, as we're having fun, time runs up very quickly. As we're coming to a close of this Strong Partnerships as a Determinant of Health session, I ask each of you to, in less than a minute, we have about 30 seconds for each of you, to just share your final remarks and views, last message that you would like to leave the World Health Summit, and hopefully together, we'll be together again in person next year. Shannon, if you may start, please.
Yes, I think I'm hearing a lot during these difficult times that as we look forward, even during COVID recovery, the economic collapse that's predicted and already being seen is so great that we should somehow lower our expectations. We should expect that there's going to be less money spent on health, less money spent on development assistance, that we should just make do. And I just sort of say we're in the middle of the biggest counter argument for that there's ever been. If you need a better example, that failure to invest in health, failure to be prepared for something like COVID, to have people in the best health possible, does nothing cost money. We're seeing that right now. And so I just hope that we can have the kind of united voice and activism that says, yes, we have to be very careful with our money, but we can't lower our expectations now. In fact, we got to accelerate. We've got to ask for more and get it done right.
Thank you, Shannon. I couldn't agree more. Hendrik?
Yeah, first, let me thank you for this really nice session to everyone, and thank you for having me being part of that. Well, my final remark would be that I really hope that also during this pandemic, as we achieved for HIV and AIDS, that we come together and that we're realizing more and more that we have to work this globally and not by country or even region. It is not about the vaccine that we have for a certain country. It's going to be a vaccine that will need to work worldwide, and everyone needs to have access, in particular the vulnerable groups. So I hope that we come to more and more to this realization, and talking about it is already the first step to getting there. Thank you.
Thank you. Andrew?
I think the sadly situation of a pandemic is also a chance. The global goals of health can only be met if we work together. We have to also recognize that without health, we have no development, and without no development, there's no health at all. We have to appreciate as politicians that health has to be implemented in all policies. And as Shannon already said, this is the best example how important health it can be, and only through multilateralism we can be a stronger global community and tackle the infectious diseases, but not only infectious diseases, but there are many other non-communicable diseases that cause haywalk, and it's also it's a restraint on economies. And only if we build back together the health community, I think that is the way to go. And I hope and I think everybody understands after this pandemic how we need to react.
Thank you, Andrew. I underscore your words. Given Katuta.
Thank you, Ricardo. I think what is important is that parliamentarians should take it upon themselves to make sure that they come up with the legislation that every government, when I say every government, I'm referring to all parliamentarians in their respective countries, that they start allocating funds that should be kept separate just for to prepare for eventualities like the pandemic that we have at the moment, the COVID-19 or any infectious diseases to curb.
Hello. It seems like we lost Given. I'm sorry for that. We'll move forward. Roland?
Yeah, I guess in this world, in summary, there's sufficient expertise from all sectors how to build resilient health systems. And what is decisive now is, in first line, the political proactive engagement, which then can carry strong partnerships, which involves and takes all sectors and actor groups with their respective special expertise along in order to effect required transformative improvements of health systems. I guess that's what we are all, as other sectors, are waiting for. We need that. We definitely need that, whatever expertise we may individually have.
Thank you, Roland. And Hila?
Yes, ending on, in every crisis, there is an opportunity. And I think if we remember that the crisis in healthcare has been already so huge, even before COVID-19, that we must remember in order to traditional models of healthcare delivery are not sufficient to reach and achieve the SDGs by 2030 or even advance to that. So I think really acknowledging that and looking for new ways to deliver healthcare more efficiently and embracing especially digital solutions as a powerful mean to an end to achieve that impact will be crucial.
Thank you so much. And we've come to an end of this extraordinary session around partnerships as a determinant of health. I'd like just to thank everyone in the panel, everyone watching, Jeffrey and everyone else who asked questions, and end by saying something that Pope Francis said a few months back, that he was saying that we find ourselves afraid and lost. We were caught off guard by an unexpected turbulent storm. We have realized that we are all in the same boat, all of us fragile and disoriented, all of us called to row together, each of us in need of comforting the other. And I would say that we need to make sure that we're all rowing in the right direction. May the Sustainable Development Goals be that beacon, the lighthouse, lighting the way to make sure that we don't leave anyone behind. Thank you all for your dedication to global health and to working for a better health for all people. Good evening. Thank you.